Okay, this video is called What Does a Low-Fat Vegan Diet Do? And this is really for people who aren't familiar with it. Most doctors, 99.9% of them, don't know about the low-fat vegan diet. Once you know about it, this will be kind of obvious. But if you don't, and most people don't, I'm just going to go through it. It's basically the species-specific diet. I think ancestral populations that were healthy, Dr. McDougall would talk about them. They would eat about 90% starch in general, 5% fruits, 5% veggies, and actually lots of these traditional populations, they weren't 100% vegan. They're more like 95%, 90% vegan. Okay, and that kept them real healthy. In the modern world, it's harder because for them, they were limited by how often they could catch meat or its availability, versus nowadays, it's just a question of what you go to the store for. Anyways, so the typical, when I talk about the low-fat vegan diet, I'm talking about a low-fat, low-sodium, whole food, intact pieces of food, organic, no oil, no caffeine, no sweets. So it basically 100% prevents coronary artery disease. And so when I say that, I mean atherosclerosis of the coronary arteries. And that also means it prevents it of the legs, peripheral arterial disease, PAD, cerebral vascular, not cerebral vascular, CVA is cerebral vascular accident, but just say cerebral vascular atherosclerosis. So it helps decrease the risk of cognitive decline. Because of the fiber, it adds water to the stool. Stool's more bulky, like a cow patty. So when you defecate, it stretches the rectal muscles and defecation's effortless, versus when the stool's dried out because of lack of dietary fiber and you're defecating with goat pellets, then you have to strain at the stool, tighten up your abdominal muscles. That's called the Valsalva maneuver, and that increases intra-abdominal pressure. And when that becomes a daily chronic thing for decades, you get diverticulosis, back pressure into the sigmoid colon with outpouching of the wall. One of those pops, that's diverticulitis. Because the stool's dry on the right side of the abdomen, you're predisposed to appendicitis, meaning dried out stool forming a stone in the appendix, a fecalith, okay, appendicolith. That can obstruct it. The mucus glands below continue to secrete their mucus, and then the appendix will stretch and then it'll burst. That's appendicitis. The back pressures down into the rectum, you get hemorrhoids. Pressures down into the leg, you get varicose veins. You get increased incidence of periumbilical hernias and inguinal hernias. Okay, so it's all bad. The stomach pops up into the chest. That's called HH, hiatal hernia. You get loosening of the lower esophageal sphincter, so you get gastroesophageal reflux disease, subsequent esophagitis. That can eventually lead to increased risk of esophageal cancer. Okay, that's where we see most esophageal cancers, GE junction, gastroesophageal junction. Okay, and I've talked about that idea before of hot disease, cold disease, cancer. So hot disease means acute inflammation. Cold disease means chronic fibrosis with subsequent entrapment of some normal cells, which thus become hypoxic and can induce the Warburg effect of mitochondrial hypoxia, leading to a reversion to a more primitive life form, if you will, anaerobic metabolism, and that can activate sort of a growth pathway and cancer. Okay, leaky gut, because, the high-fat diet's predisposed to leaky gut, increased intestinal permeability. So does oil in the food, okay? So does caffeine, excessive psychological stress, alcohol, antibiotics, excessive fluoride from tap water, aluminum from tap water, chlorine from tap water. So you want to filter your water, reverse osmosis. But anyways, leaky gut then allows bacterial endotoxins to get into the blood. Those increase your risk of clotting. They increase your risk of autoimmune disease. The dietary fiber prevents that, because the good bacteria in the gut, they take that dietary fiber, convert it to short-chain fatty acids, in particular butyrate, 4-carbon fatty acid, like a butanoic acid. It's used by the intestinal lining cells, the enterocytes, because the gut's called the enteric tract, to make tight junctions so the bacterial endotoxins can't get in. Also, large chunks of protein can't be absorbed, so you prevent autoimmune disease by preventing, autoantibody cross-reactivity, molecular mimicry with autoantibody cross-reactivity. It's a molecular mimicry from animal proteins because they're more like our body's own proteins. That's why the antibodies can cross-react, like to the thyroid, and give you Hashimoto's, etc. Okay, hypertension. Well, first of all, obesity, because the more fat you eat, the fatter you become. And then, like Dr. McDougall would say, the fat you eat is the fat you wear. Hypertension, because the fat sticks the red blood cells together. Red blood cells have a negative charge on their outer surface called a zeta potential. In the Bible and Proverbs it says, fear of God is the beginning of wisdom. Well, for understanding blood flow, the beginning of wisdom is to understand the zeta potential. All red blood cells, all other blood cells, and the arterial lining, the endothelial glycocalyx, all have a negative charge on their outer surface called a zeta potential. The negative charge comes from the glycosaminoglycans like heparan sulfates, from the cholesterol sulfates, and also from the end of the molecules having on the glycosaminoglycans, having sialic acids like the immune system identity card. All of that stuff's negative charge, generating a zeta potential. Whereas fat will have a tendency to generate positively charged molecules in the blood, which will be big enough in size, like LDL cholesterol, to bind to the red blood cells and stick them together, overcome the zeta potential. Okay, chylomicrons will do that as well. And then the blood becomes thick. So, remember, a red blood cell is 7 microns in diameter, a capillary is 5 microns in diameter. So it has to bend already to get through that red blood cell. You stick them together, and it's hard to push those RBCs through these capillaries, so pressure has to go up. Why do you have a blood pressure? To get blood to the top of your brain. Okay, so if you're pumping a milkshake to the top of your brain, you need more pressure than if you're pumping normal blood that's like water. And then if you eat high dietary sodium, like think about a pizza, high in fat, high in sodium, that causes vasoconstriction because it inhibits the endothelial nitric oxide synthase. Nitric oxide is a vasodilator. So you're going to now be pushing thick blood through a constricted system. Pressure has to go up more. Plus, in addition, the high sodium diets cause platelet activation, making them more sticky, predisposed to clotting, and that will also make the blood thicker, increase blood viscosity. If you got leaky gut, you'll also get something called amyloid clotting because the bacterial endotoxins, LPS and LTA, cause a transformation of fibrinogen, the blood clotting protein, from alpha helix to beta pleated sheet. And the beta pleated sheets are like a deck of playing cards. Alpha helix is cylindrical, like a slinky. So they stack up together, which means they're predisposed to clotting. The higher the molecular weight in aqueous solution, which is blood plasma, the more likely something will precipitate, which is to clot, thus leading to these little clots forming all over the place. They're called amyloid clots because the secondary protein structure has changed from alpha helix to beta pleated sheet. And so now, once again, your blood's becoming thicker. All of this is bad. You don't want your blood to be thick. What is atherosclerosis? Atherosclerosis is a blood clot. Anything that makes the blood predisposed to clotting increases your risk of having a heart attack, of forming atherosclerosis. Okay, that's how you know what an atherosclerosis risk factor is, something that increases the risk of blood clotting. The reason why cholesterol is the biggest one is that's such a common thing in a Western country with all the high-fat diets predisposing to clot formation in the blood. Okay, so that's high blood pressure. So in countries where they don't eat high-fat, high-sodium diets, they don't have any hypertension, okay? We know what causes it. All this essential idiopathic hypertension is BS. We know it's high-fat, high-sodium diets. Okay, diabetes. Main risk factor for diabetes is a high-fat diet, especially saturated fat. There's other things that will also increase insulin resistance, but that's the big one. Psychological stress, caffeine, sleep deprivation. They all elevate cortisol and so will increase insulin resistance. But the most important thing is eating a high-fat diet. So you don't want to eat a high-fat diet. Right now there's confusion because the most common group of vegan nutrition people on the internet is the high-fat phonies, and they're all pushing nuts and seeds and avocados and olive oil and canola oil, all this nonsense. They're full of crap. They're lying to you. I'm telling you flat out, they're lying to you, okay? They don't like me. I'm ostracized from them because I tell you the truth, okay? I'm trying to help the pros. For them, it's a business, so in order to make money, you have to sell stuff. You have to promote stuff. I just do it as a hobby, so I don't have to sell or promote anything, okay? Plus, I'm a big believer the only way to reform healthcare is Christianity, because Christianity says it's more important to tell the truth and help people than it is to sell out for money. And you need something that has the moral foundation to put the truth above money, because there's always more money in lying than there is in telling the truth, especially in healthcare. Okay, what's next? We talked about preventing autoimmune disease, and by preventing all this clot formation, you also prevent plugging up the small arteries of the heart, so you minimize the risk of atrial fibrillation, you minimize the risk of congestive heart failure. By avoiding the meat, the cooked meat, which produces, a lot of sulfur amino acids in the colon, they get converted to hydrogen sulfide. That'll increase your risk of colon cancer. You also get heterocyclic amines, lack of dietary fiber. All of those things increase the risk of colon cancer from eating a high animal food diet. So you want to avoid all that stuff. Also, the animal foods, often be high in iron. Processed foods are also high in iron because they're fortified with iron. Iron can do what bacterial endotoxins can do in the blood. If you think about iron, it's a transitional metal. It has a variable valence. It oscillates back and forth between Fe2 plus and Fe3 plus. That's called ferrous redox cycling. In so doing, it hands off electrons to adjacent molecules like the fibrinogen, and it'll predispose to amyloid transformation of your fibrinogen clotting protein, just like LPS and LTA, thus predisposing to small blood clots forming in your blood. And again, that makes your blood more prothrombotic. It increases your blood viscosity, makes it thicker, predisposing to hypertension, and because it's prothrombotic, to atherosclerosis. Okay, so we talked about almost always a low-fat, low-sodium vegan diet prevents all of this stuff. And it usually prevents, not always, but usually prevents autoimmune disease, AFib, CHF, colon cancer, and diminishes the risk of prostate cancer, of breast cancer, and a lot of other cancers, okay? If you catch these diseases early, you can usually cure them. So it's one thing to prevent a disease, it's another to cure them. The more chronic a disease is, like let's say the more chronic hypertension is, the more the arteries will be diffusely calcified, and the harder it will be to fully reverse it. But you still can usually get a benefit and partially reverse it. Same thing with the pancreas and diabetes. If you catch the person, within the first 4 years, almost for sure, and later, quite often, you can reverse it totally if it's type 2 diabetes. If it's type 1 diabetes, that's usually more of a child onset thing, and you've lost pancreatic function already. And then there's an intermediate form called diabetes 1.5, which is partially autoimmune. So it really depends on how much pancreas function is lost. But even if you lost all your pancreatic function, the same diet minimizes insulin resistance, so it'll increase your insulin sensitivity and lower the amount of insulin you need if you're a type 1 diabetic, for example. And then the question is, well, why is this diet so helpful? Also, it improves blood flow because it decreases back pain because it improves blood flow to the spine. It'll tend to reduce headaches because you avoid a lot of the toxic chemicals in processed food. So why is it so helpful? Because number one, like I said, this low-fat plant-based diet, and I realize in the wild they'll have a little bit of animal products. I recommend 100% vegan. Most people have been eating a lousy diet up until middle age, then they start getting sick. They got the resilience when they're a young adult to just handle it. But the older they get, they can't handle it anymore without getting sick. So they need to fully turn it around. It's like detox, if you will. Low-fat vegan optimizes blood flow, optimizes dietary fiber, optimizes antioxidants. It's alkaline. All of this makes life a lot easier for your kidneys, a lot easier for your immune system. It optimizes immune function. So all of these things help you, And what's the weakness of a low-fat vegan diet? There's a possible need for vitamin B12, which is actually a very controversial subject. If you're curious to learn more about that, check out the book by Anthea Hayes called The Enigma of Vitamin B12. I do think the vegan diet's a little bit less anabolic, okay? Because you don't have the meat, you're going to have less amount of the amino acid leucine, which has a bit of an activation effect upon mTOR. When you're young, that might slow down muscle mass development a little bit. But there's benefits for it too, especially as you get older. What you don't want to do is have accelerated cell replication, which can increase your risk of cancer. There's also, the relative lack of creatine in plant foods. So you can still be pretty strong. You can still have fantastic endurance. And there are ways to work around that I've talked about in other lectures. I'm not going to go into that now. But this was simply for people who don't know anything about the vegan diet. So the bottom line is it prevents and or cures all the common chronic Western diseases. What more could you want? You won't get a better deal than that in anything in life. I could do anything I want. I've studied this for decades. This is as good as it gets. So, almost all the patients in the real world have the same disease. They have hypertension and prediabetes or diabetes, causing atherosclerosis along with all this other stuff on here, plugging up the arteries in their brain, their heart, their eyes, and everywhere else, their spine. This is how you avoid it, and this is the only way to avoid it. So you might as well go down this path. All that paleo, keto, carnivore is nonsense. And the high-fat phonies, a lot of them are pretty smart, and they do tell you a lot of good information. But then in order to make money for their businesses, they start selling you all this nonsense. So you have to be careful with them. You can learn a lot from them, but you can't fully trust them because they're going to BS you. And you also got to watch out for estrogenic stuff. Forget about soy and flax. They're estrogenic really in high amounts. You don't want that. And processed foods often have estrogenic chemicals in them, like the glyphosate, like the atrazine, etc. So you don't want that stuff. Anyways, I hope you found this helpful.